Hello everyone, this is Mahima here to explain my fourth experiment in CaseTools lab to draw a collaboration diagram for a hospital management system application. So first of all, for this experiment, I have created a separate collaboration diagram for four functionalities. The first one is for the patient check-in, the second one is the treatment of a patient, the third one is for the admission of a patient, and the fourth one is the payment procedure. So first of all, for my patient check-in, here as you can see, these are my objects, and as you can see, these are my messages, and these show the direction as to how my objects communicate. And unlike a sequence diagram, a collaboration diagram, it doesn't have a timeline. That is the basic difference between both of them. Rest all of the things are totally similar. So first of all, here I have my reception object and my patient object. So first of all, the patient checks in. That is my process 1. Then when he goes to the receptionist, then the receptionist first of all gives the admission form to be filled. And after that, the patient fills the form and gives it to the reception. And then the reception then checks for availability of the doctor. And once he checks for it, he gives the appointment, which is the process number 5. And then he assigns the doctor. Now for the second activity or the second functionality, we have three objects, that is patient, doctor and pharmacy. First of all, the doctor checks the patient and then he gives the treatment. After that, he prescribes the medicines. Then when the process of treatment is done, the doctor then checks for his next available date, which we have a what we call as a self link. Once he checks that, he gives the next appointment date, and then he gives the medicines. I mean, he prescribes the medicines, which the patient can get from the pharmacy. That is our last process. Now, my third functionality is the patient getting admitted. So here I have two objects, that is receptionist and patient. First of all, the patient fills the details regarding his needs, his necessities and all. Then the receptionist checks for the room availability. Once she checks, he assigns a respective room to the patient. Now my fourth functionality is the payment procedure. Again, I have two objects, that is reception and patient. First of all, the patient gives details, that is based on whatever he was going through about his illness, about the treatments he got, and then the reception checks for the patient details. After that, he gives the overall bill, and then the patient pays based on his desired way, that is, it might be card or cash. So that's all for my experiment. Thank you for watching.